Slightly bulges from the chin, hips, thighs, arms, and tummy. We've got the latest information on removing fat with liposuction. Welcome back to Fox on Health Weekend. You exercise regularly, you eat a healthy diet, but you still can't lose that extra fat from the hip, stomach, thighs, you name it. Well, liposuction could be a procedure for you to consider. And here with the details from New York's Beth Israel Hospital is plastic surgeon Derek Antel. Dr. Antel, nice to have you back.
Thank you, Carol.
Let's just kind of review the basics of liposuction. First of all, what is it?
Well, liposuction is a technique that removes excess fat in localized areas. It's permanently removed when it's removed from that area. We place a small surgical tube under the skin and literally vacuum the fat out. And what about, people say, well, how many times can you have liposuction? So you got the fat out, is it going to stay out? Is it? Well, the good news is yes, it will stay out. As far as how many times it can be repeated, there's certain guidelines we like to stay within in terms of how much volume is removed at one time. So in more severe cases, we may need to repeat the procedure. In most cases, if there's a select area where there's a problem, women it might be their outer hips, and men it might be their love handles or a tummy roll, one procedure will do it. Okay. Is there any medical predisposition that would make you eliminated for this kind of procedure, not make you a candidate for it? Yes, there may be some underlying cardiac problems that would need to be evaluated. We are physicians first. We want to evaluate our patients. But most of the patients that we see that have this problem, it's a fairly short procedure. It can be done under local anesthesia. I was going to ask you, is this major surgery? I mean, do you need a general anesthetic, or can you have a local? It can be done under local, but we usually give some sedation. It's sort of a twilight sleep, so the patient is relaxed during the procedure. Otherwise, you'd feel the injection of the local anesthesia. So we do whatever we can to make it as comfortable for the patient as possible. And this is done in the office? Yes, in most cases it's done in an office setting. We have our own operating room here in New York, and the patients have it done and go home with an escort, and then we see them back within a few days. Let's talk about some of the different techniques. You have an instrument here. I don't know if we want to do a little demonstration short of the surgery itself, but can you explain this particular instrument and how we can use it? May I hold it here as a skip location? I think this is an example of the instrument. I'd like to point out... That's not a pleasant-looking instrument, Doctor, I have to tell you. But I know in the right hands it'll be fine. Well, it's important that it be controlled properly, obviously. There's an opening on the end of it, right here, a little opening that allows the fat to enter the tube, and it comes back along here, and it's literally removed by a tube to a canister. Now, this is considered... Is there another end on the end of that? Is that open? Yes, I'm sorry. Oh, I see. Right here. And a tube is attached from here, and it goes to the machine that causes the vacuum. So this is just actually making the contact with the fat that's underneath the surface? That's right. Just the tip. Really just the tip. And let me point out to you that the tip is blunt. It's shaped like a bullet, or I'll put it down here like a bullet or like a submarine, so that it really can't cut anything. It pushes things away. Things are pushed away. It's shaped like a submarine so that it can push things away. And that is the basic tool that you would use in what kind of liposuction procedure? In most liposuction procedures, that tool would be used. Or instrument, I should say. Yes, we prefer to call it an instrument. And it's very carefully placed into the fatty tissue, and when the suction is applied, the tissue is drawn back out of the area. Exactly. Okay, we're going to talk more about this. If you have a question, call us now at toll-free at 1-888-TEL-FOX. Stay with us. Welcome back, and we are talking to plastic surgeon Derek Antel about the latest techniques in liposuction. And now we're going to do a little show and tell and see what happens when you have this kind of liposuction. So, Doctor, why don't you take a look at the pictures here? Carol, this patient is, in my opinion, an ideal candidate for liposuction. She's basically in good shape, as you can see in the before. But she had an area roughly from her belly button on down that she just couldn't lose, no matter how many sit-ups she did. So we performed a liposuction procedure on her to remove that excess fatty tissue. It's really quite you're talking about maybe a 2 or 3 inch difference. And all of that is just fat buildup. It really is just the way fat is deposited in your body. That's correct. Not necessarily how fit you are or whether you're at the correct weight. Exactly. Many of the patients that I see work out regularly. We want to also call another one up here, and that's the chin liposuction. So let's take a look at that. Okay. Oh, yes. This lady. Quite dramatic. Thank you. This lady had liposuction in that area to remove the excess fatty tissue, and it allows the skin to retract. Now, in a younger person, the skin's more elastic. You'll get more retraction. Sometimes we may do a neck lift as part of the procedure as well.
Now, this is the direct result of the surgery. We're not talking about somebody losing a couple of pounds in here in the before or after.
She did not lose weight in between.
That's really a direct result of the surgery. It's really quite amazing.
Thank you.
We have a caller. Denise is calling us from Boardman, Ohio. Hi, Denise.
Hi there. My name is Denise. I'm 26 years old, and I was considering getting, it's called abdominoplasty, that's liposuction from the stomach and on my thighs. But I wanted to know, what is the infection rate, and does the rate depend on where you get it done?
Good question.
Abdominoplasty is actually removing excess skin as well as removing fat. We need to clarify that a little bit. If it's just removing excess fat, which would be liposuction, the infection rate is very, very low. It's less than 1%. Sometimes there may be just a little bit at the wound entry point. Abdominoplasty has a slightly higher complication rate, so you'd want to clarify that with your surgeon beforehand.
Now, what about the rate of infection where this is concerned? I mean, I would imagine that is a concern for a number of people.
Yeah, as far as the wear, obviously it has to be done under sterile conditions.
Right.
And I think you need to talk to your particular physician about his facility or where he plans on doing it and what the infection rate is like there in particular.
Can we just talk a little bit very briefly about the ultrasonic liposuction?
Sure. Ultrasonic liposuction is a newer technique that was done in Europe for about 10 years already. It's a similar cannula, or similar metal tube to what we've been using all along, but a sound wave goes through the tube and it vibrates at a very high speed. And what that does is it disrupts the fat cell, and then the fat is actually vacuumed out. So
it's just easier to kind of get it out.
Yes, so it doesn't eliminate the traditional technique.
Right. Just makes it easier.
It makes it easier on the surgeon, actually.
Dr. Antel, thank you so much for joining us.